we encourage you to subscribe to MedSearch Moments wherever you listen to podcasts.
Do you have plans September 12th through 14th?
The AMSN Annual Convention is the can't-miss event for medical surgical nurses.
Register now to join AMSN in Toronto, September 12th through 14th, 2024.
And prepare to connect with hundreds of peers for 3 days of learning, the latest insights, trends, and best practices in the specialty.
Visit amsn.org to secure your spot.
This is Eric.
Maritess.
Sydney. Sam.
Neo.
And Laura. Welcome to MedSearch Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
We're proud MedSurg nurses just like you, sharing our stories, insights, and experiences to support you in your nursing journey.
Our topic today is nursing research, how any nurse can get involved and why it's important. But before we get started, given that this is Sam's first episode back from maternity leave, I know everyone's anxious to hear about how she and the new baby are doing. Sam, can you give us an update?
I would love to. I'm so happy to be back. Everything has been so great. The last 3 months were just amazing to be home. Little Theo made his arrival on March 23rd. We had a scheduled C-section because he was upside down. He was breech, and that went absolutely perfectly. We were home the next day. A little foggy after that, maybe for a week or two, but he's such a great baby, and we've learned so much as new parents. We've had so much support from our friends and family. We're so thankful for, and now I'm back to work. Today was the beginning of week 3 that I've been back, so just kind of learning some new routines and that kind of thing. But my husband gets to take his leave, so now he's home with them for the next couple weeks as well. And so that's a huge blessing too. So yeah, everything has been great. I've definitely missed engaging in this and talking to other people. Talking to a baby doesn't often have very fruitful conversations, but being a mom is just unlike anything I've ever experienced. So super thankful for that. I also wanted to give a quick little shout out to AMSN headquarters because they sent me a super nice handwritten card congratulating me on the birth of Theo. So thank you to AMSN HQ. It was super, super thoughtful.
That's so nice. Well, we're so excited to have you back with us.
Thank you.
Sydney, what's going on with you?
I'm doing good, Laura. Thanks for asking. And Sam, I'm so happy that you're settling into this new role of motherhood. That's so exciting. For me personally, my brother came to visit recently. He just moved up to the Netherlands back in February. So he came down to visit me in Spain for about a week. So we had a good time. I got to show him the beach and some of my favorite restaurants and stuff around here. So it was fun. Maritess, how about you?
Every time you mention Spain, Sydney, I always go to Google Flights or Kayak. I'm like, let me explore how much is the flights going to Sydney. I mean, I need to visit
too. I feel the same way. I'm just impressed. Yeah, with you being in Portugal and now your brother's in the Netherlands, it makes me want to travel.
Right? And I always like, look, okay, I can't take PTO on these dates, but thank you for always sharing those updates. It makes me inspired really to go out there, travel.
It's about to get miserably hot. My air conditioning was broken for the last 2 weeks. So thankfully it just got fixed because we're in a bit of a cool spell right now, but it's going to get very hot really soon. So I was really pushing to get that fixed quickly.
Oh, wow. So it gets really hot, humid there?
It's going to be high 90s. You know, it's nice to be hot when you're at the beach because then you just go in the water and cool off.
I'm from Texas. That's not hot.
Same here in Florida. That's really okay.
Oh, then you guys are good anytime.
Fine.
Yeah.
I'll go by there next week.
Perfect.
Okay.
Perfect. My air conditioning's working, so it'll be nice.
For me, I shared last episode about my kids going to in-person brick and mortar school. So it's really happening.
You doing okay with that, Maritess?
Oh, you can tell I'm breathing. I'm really doing my deep breathing exercises because there's 4 of them going to different schools. So 2 different high schools. One is doing IB curriculum in a different school. Another is doing pre-med in a different school. Another is going to middle school. And my first grader said, I want to go to school too. I'm like, you have to stay at home. But that's where we're at. I think it's going to be fun. It's going to be good. That's where you really go look for your support system. And I'm so very blessed that we're all on the same page. We're all going to be working together, making it happen for all of them. It's about time because they really need to increase more of those social skills. One of the things that my other high schooler said she realized she has social anxiety. And I said, the only way to really get over that is go out there. And I mean, she's volunteering, but to be out there really to communicate, develop all those soft skills, I think that's the way to go. So even though I feel like this is going to be a very difficult year, it will be fine. I just told them, you can't come with me in Toronto in September. And they were like, oh no, Mom, that's so true. Because they're no longer homeschooled. So you had to go in person. I said, looks like I'm going to go on my own and you're not going to travel with me. So they're kind of like thinking about that, but everything's going to be fine. Professional wise, we had our surveyors come in. So it has been a tough 2 weeks, but all is good. I think we need to embrace that we always have to be checked every now and then to see where we're at, how we validate our practice. And I think our topic would be an extension of what I wanted to share. So far, everything is good. 2 more months before the school starts.
Enjoy your summer.
Yes. Actually, we went to Disney over the weekend. So everything is going to be in person. I'm like, okay, we need to plan our vacations all throughout the summer. So we're planned back to back this weekend until the first week of school. So it will be good.
We've got a family vacation coming up here in the next couple of weeks. I'm meeting my family at a house in Outer Banks, North Carolina. So right now, my husband is just very in tune to the weather, making sure that we're not going to have hurricanes or tropical storms or something like that. But we'll see. I'm excited.
Probably good to be aware of any hurricanes that are
He'll keep an eye on up there. He's actually on taking a little solo trip up to New York to see his family. And then he's going to drive and meet me in North Carolina with my family. So happy for him. This is his first solo trip in a while by himself. So I'm excited for him. I know I enjoyed my solo trip that I took a few years ago. So why don't we go ahead and move on to our topic? Our topic today is nursing research. And to get us started, I thought I'd share the reasons why I submitted this topic. I set a goal for myself to submit an abstract for a nursing conference. I am surrounded by an amazing group of colleagues at the facility where I work that are always getting selected to present at conferences. I had always done it as a part of a group, but I had never submitted one on my own. I was really afraid to write an abstract. But I kind of bit the bullet and I found some bravery somewhere down in my gut and I wrote an abstract and I submitted it. And now it has been accepted and it's going to be available for people to come by and see at the AMSN conference in September. So I was really, really, really excited about that. If I had that fear, that maybe others also had that fear, and I want them to know that it is very, very, very possible. I had so much support from my colleagues, and the process was intimidating at first, but just take it step by step, and it was no problem. I am very, very excited, and I'm excited to try to do it again in the future.
Congratulations, first off. That's so exciting.
Thanks, Sam. I appreciate that. Thanks, Maritess. Have y'all been through that process?
I have, yes. I've actually presented at 3 different conferences.
Look at you.
Yeah, it was really fun. None of mine were like true research projects, which maybe we'll get into, like kind of defining what that is, but more so like quality improvement and implementing EBP for onboarding and orientation. Once you do it one time and then you get accepted and get to go do the whole thing, it is exhilarating. It is so fun and exciting and very fulfilling. It's such a huge sense of accomplishment. I was pretty much a brand new educator, like 2 years in, I think, is when with one of my colleagues, we actually presented at 2 different conferences in the same week. That was quite the whirlwind. It's truly amazing and definitely something that's attainable from bedside nursing to educators, everybody in between. It's not just for people with PhDs already and stuff like that.
I've never presented in a national conference, But interestingly, because I'm always part of the planning committee for conferences, so I've seen all the abstracts, how it's done. It's tedious to do. It's a lot of work to do, but it's fun to do. Why did I never submit one? I think because as an educator, it's what we do every day. And I say that, like, if I get an education request, the first thing that they would ask, I need something on this and that. The first thing I would do is to look for evidence-based practices. I can't just say, oh, this is how you're going to do it. And then I look for the policy. And then if the policy is part of the evidence-based practice. So now that I'm talking about it and I'm just saying it out loud now, it seems to be like, this is what I do in a daily basis. And so maybe I should try to go put something together with the many projects that we do each day. So many initiatives that we do in the facility, how many times we change the policies, how many times we change to improve processes. That's a really good point because it's true. You just have to start, you'll get through it. And I can imagine when you were sharing about back-to-back, you did the back-to-back presentations, adrenaline probably is like, off the roof.
Yeah. The first one was a podium presentation, and then we had a poster presentation on the same topic at the second conference. But yeah, the podium one was exhilarating already. And it took a few minutes to kind of loosen up, and then we got into it, and it ended up being a really great discussion. People came down, had lots of questions. We got tons of emails after sharing more information. We had meetings with people. So definitely some really great networking opportunities came out of it as well. When you're talking about, well, it seems like my everyday work, it can be sometimes hard to like narrow it down and think, what could I write an abstract about? Was this a research project? Was it an EBP implementation? Whatever it may be. And so my key advice that I've shared like with my coworkers too, and new educators who have joined my team and people who have asked, is you have to keep in mind, what are you going to measure? If you don't have something you're measuring, you're not going to end up with something at the end that you can show and prove that what you did was effective. Did it improve patient outcomes? Did you save money? Whatever it may be. But when you get started, you have to think about, what am I trying to measure and how am I going to articulate that at the end?
Sam, I'm really glad you made that point about what are you measuring, especially for a quality improvement type of project, which is what a lot of us nurses do, especially the educators do all the time, trying to make the processes better for the patient. How do you measure that? How does that become a project? So I'm really glad you made that point about what are you measuring?
I'll quote one of the speakers that I was with, Dr. Alex Wasserman. He did say that without data, it's merely your opinion. And I agree with that. If you don't have the data and then the data, you can't measure it, and then it doesn't have an evidence that it improved the process, definitely it's like, nothing. The evaluation part is always the key point, whether it's a good research or not. Very good point.
I spoke with our research department because I think I've mentioned before, I'm in my DMP program. So I'm kind of getting ideas for what I want to do my project on. So I reached out to our research department. And that is really one of the first things she said is that anytime we're going to do an EBP project or a process improvement project, it's not a bad idea to talk to your research department if you have one at your facility, because they can remind you to ask those questions. At the end of this project, what do you want to see? What kind of results do you want to be able to show? So taking that survey data before, measuring the data through, and then at the end, going back in and seeing how it works, she said that's where you get the meaningful data. And that's what contributes to the changes in nursing practice. And if we can go on to publish our results, then we're going to add to the literature that's already out there, which can inspire other people to take it another step further or in another direction.
Do you think it would be helpful for our listeners if we kind of maybe defined the differences between research and evidence-based practice?
Absolutely.
So the way that my organization likes to talk about nursing inquiry is to separate it into 3 different categories. First being a research study, which that means that there are gaps in evidence, meaning that we don't even have the evidence to know what is the best practice. So that's where we have the whole scientific process to gather that evidence and then publish that out for implementation. Then we have evidence-based practice. So that's where we start with gaps in knowledge of the best evidence for practice. So then we try to find that evidence through other research projects that people have already done and translate it into practice and implement that for our patient care. And then we also have the quality improvement activities, which seems like a little bit of a mix of both, where we start with evidence of gaps in practice, maybe do some PDSA cycles, try to implement those, and then see if we can adopt those evidence-based practices to improve our patient care. So hopefully that gives some good definitions for the 3 different kinds.
Absolutely.
So is yours like an actual research project?
We implemented a PCT phlebotomy training program. So it started with
like pipeline type stuff.
Yeah, our turnaround times for getting stat labs were too high. And it was because we had a lack of phlebotomy support. So now we're training PCTs on the unit to draw stat labs. So we have our turnaround times that improved after we implemented the project.
That's like quality improvement. Yeah, mine was definitely quality improvement as well. It was about implementing microlearning into daily shift huddles. And we had a huge reduction in happies after doing happy education. On my poster, I had project purpose, the background, topic selection of the microlearnings that we did, the process, and then some measurable results related to the happies on that one specifically, and then ongoing work and implications.
Maritess, you were talking earlier about how it seems like going through this process, it doesn't feel special. It feels like it's something that we do every day. Well, when I went to the last conference and I started walking around and I saw the other projects that people were doing, I realized that it is something that we do every day, but we each have a different spin on it. So even if you feel like it's not unique, you can still make an impact by reporting your data and talking about your results. So the posters at the conferences all have a very similar structure. You know, they're not exactly the same, but we talk about the different areas, like the purpose of the project. You have to talk about the background, what methods you used, what your pre-implementation data was, you know, what caused you to decide to do this project, and go from there.
Now that you share that, and then this is just an opinion, whenever I go with my team and we go around and we see, oh, we already did this, we already did that.
Right. But if you read it, if you take time to read the results, you'll see they may have different results than you. They may have another path to take or something else to try, or it might inspire you to make a change to something that's coming up. Yeah. It's like Sam was talking about after she presented at the podium presentation, she got emails because going to these conferences inspires you to think.
I agree with that. You distribute it because that's the last step, to share your results, to share your findings, and maybe perhaps other people can learn from it.
I went to the AMSN conference in Las Vegas last year, and I went with a colleague of mine who had a poster there, and we walked the whole area together. And together we decided, you know what, these are all very doable projects for our organization. So we took that information back to our organization, and over the past year, we talked about it. We talked about our experiences. We talked about what we saw and the kind of projects that we saw. And this year, we had 3 posters accepted. So it increased our submissions.
Wow, that is so amazing.
So we want everybody out there, we want all of our listeners to get excited about it and to give it a shot. Sam, can you tell us a little bit about your presentation?
Yeah, I would love to. So I submitted an abstract and had a poster at the AMSN conference in 2022. I actually partnered with a unit clinical coordinator or designated charge nurse. At this point, I'd only been in the education world for about 2 years, so still quite new at it. But then to be able to partner with her and do this together and have this poster presentation was really exciting. My poster was about transforming a daily shift huddle using microlearning. We wanted to implement little tidbits of education into an already existing mid-shift huddle on both day shift and night shift on an ortho neuro med-surg unit. And so this clinical coordinator came to me. She had been through the COVID trenches, tons of brand new nurses, tons of travelers, all working on this unit together. And her, along with myself, manager, other leaders, huge gaps in practice and knowledge and all sorts of things amongst this workforce. We decided we needed to try to integrate education into their daily work. We didn't need to do anything extra. We didn't want to have modules coming in on days off, anything like that. But if we could capitalize on the mid-shift huddle that was already happening and integrate the education there, could we make a difference? So on our poster, we talked about the purpose of our project and the background. And then I talked a little bit about our topic selection. So obviously we wanted to make sure that these topics were really relevant to the nurses, things that were happening, things that they knew that were thorns in their side that they didn't know a lot about, and also that we knew would have a big impact and something that we could measure. So our nurse sensitive quality indicators that I know we had an episode about a few months ago, things that were already being audited. Then we talked a little bit about the process, just kind of described what the huddle looked like, how we developed the materials. So the staff had a fun, colorful handout that I would make on Canva. And then whoever was facilitating the huddle would have kind of a script basically to go off of, just to make sure that every staff member was getting the same message, no matter what shift you were on or who was facilitating the huddle. So we talked a little bit about that. And then our example that we gave for our results and a measurable outcome was our rate of hospital-acquired pressure injuries. So at the end of 2021, there were 5 in June, 3 in July, 6 in August, 6 in September, 13 in October, 11 in November. So huge amounts of hospital-acquired pressure injuries. That was also the time during our biggest COVID surge. We did this intervention, our very first month of this huddle education we did in January of 2022. Following that in February, we only had 2 happies. March, there was 2, April 1, May 0. So we saw a huge decrease in happies after we really targeted that education during this huddle. We talked a little bit about staff satisfaction because we measured that as well with a little pre and post survey. Talked about our ongoing work and then our implications of our project. So that is my poster outline there.
That is impressive data.
I like the zero in 1 month. That's cool. From 13 to 11 and then intervention at 3 to 0. That's cool.
Yeah, it was a huge improvement. And obviously, it's good to know we're not harming our patients with happies and things like that. But then we were also able to show the cost savings of that. Average cost of a happy, I think it's anywhere from $40,000 to $140,000, somewhere in there, depending on the stage. So to be able to have that range of cost savings for the organization is really huge too. So
yeah, that's great as well.
Yeah, we were really proud. She didn't end up being able to go with me to present, but I went down to San Antonio by myself and presented this and had some excellent networking, and it was a great time.
I think I was at that conference in San Antonio. I think I was.
Yeah, it was a good time.
So EBP can be intimidating, but you can always find a team to work with.
Something that we kind of figured out at my organization as well in terms of actual research is the word research really scared people.
Absolutely.
I think nursing school really scarred a lot of people, especially those that went through their bachelor's degree. The word research just makes them shudder and turn and run away. So we ended up trying to rebrand it as new knowledge and innovations, trying to pull some of those magnet words out of there instead of research. We definitely had some better engagement when we branded it that way instead of research.
And especially for magnet organizations that have research teams available, it doesn't cost anything. It's a little bit of effort to just send an email and talk to someone who has some experience in it. And just to remember that you don't have to do the entire research project all by yourself. You don't have to understand how to interpret all of your data. They have statisticians. They have nurse scientists, people with experience. It doesn't have to be as intimidating as we make it out to be. Because you're right, it is scary. It's scary to see those research projects that are out there, and sometimes they take years to complete.
Statistics. That's a scary word for some people because it's math.
For some people, but there are some people that love it.
Yep.
And so if you get one of them on your team and you give your numbers to them, they're going to turn it into something beautiful.
And there's software for that already. So I think to your point, collaboration is the key to make a research project.
Yeah, but doing these research projects is what keeps nursing moving forward. There's a lot of things on the horizon for us. I know we just had an episode where we talked about virtual nursing and the future of virtual nursing, and we touched on the possibility of AI. There's a lot of research that's going to be coming our way, and we have to get comfortable with this process so that we can participate in that.
I agree. Just to tag on what you said about the research and AI, I learned from a conference that we do not have a lot of research about AI and nurses. So I hope for those who are listening out there, if you find a pain point in your organization and find something that we can use AI, I think we need to really start looking into that as well. We had an episode of 106. What would you do if you want to invent something in the future? And I heard someone, because I said something about if you can record like everything you say. So there's now a voice assisted AI that may be used for documentation. And that's like amazing. That's like how many months ago? I can't remember, but isn't that amazing? We really just need to do research and data gathering about that.
As the resident floor nurse in the room, how can floor nurses support research or evidence-based projects that are going on in their unit? I know sometimes it can be difficult to get that support. Oh, it's another project. Oh, it's another change to my daily routine. What can we do to get the floor nurses to support these projects that are going on within their hospitals?
It's really important to find a few people who are really excited about it, who can help be those champions for the inquiry and also help with like the change management piece. When you can have some people who are super excited about it, really supportive, can help with that buy-in piece for like the rest of their department and their peers, that can be huge in the success and at least an engagement in the process to figure out if the research project or EBP is actually worthwhile. We got to have good data, at least something to go off of. And so I think being a cheerleader for that engagement can be really, really integral to the success of a research or EBP project.
And also try and point out how it could benefit them. What change are you trying to make, and how does that end up looking? I mean, what do we want this to look like? How is this going to benefit the people on the floor?
I agree. Participation. How many surveys we put out there in the floor and no one answers the survey? Or we ask for, okay, be honest with the survey and then you get NA, not applicable. I get that all the time. Nurses can support by answering meaningfully, because this is done to improve the practice. This is something that we're doing to help our patients, to help our practice. And so be honest with your answers. Do not be afraid to speak up. I know I've heard many nurses say sometimes, I'm not answering the survey because it has my identifier. People will know who answered the survey. These are non-biased questions. This is for us. This is for us to improve our practice, to improve our patient care. Use that voice. Use that voice to improve the nursing practice.
I also think you have to want to. You've got to find other people that want to participate. And sometimes that's hard. There are people that just don't want to participate. And that's okay too. I think you have to look for other colleagues that are passionate like you. I think committee participation is a great way to find other people that are engaged. And it doesn't always have to be nursing. Other ancillary departments can contribute to these projects as well.
Yeah, I think it's definitely helpful from the floor nursing standpoint of having the educators or whoever's doing the project come and explain the point of it, what they're trying to improve, how it's going to benefit the nurses or how it's going to benefit the patients. Because I've had the experience at times where all of a sudden we're doing this whole new process and, oh, well, this is an extra step to my day. Why am I doing this? Why do now I have to make sure with the discharge paperwork, I have to give out this pamphlet? Or why all of a sudden are we doing discharge phone calls? Doesn't the clinic do that? You start to feel like, oh, I'm doing this person's doctorate for them versus explaining why this is happening and what's the goal at the end of the project is very helpful.
How it benefits the patient, but also how it benefits the nurse.
Right.
I find that I get a lot more participation when I bring chocolate with me. Just
Candy helps. Candy definitely helps.
Especially if there's Snickers and Twix. That's
the good candy.
Yeah, the good stuff.
Well, believe it or not, we're just about out of time. But before we go, let's quickly summarize what we learned. Research often begins with something you've already experienced at work daily and would like to see improved. Don't be afraid or intimidated by research. It is not just for PhDs. Nursing at the bedside can participate as well. Always ask yourself, what am I trying to measure? when you begin planning your research or even your EBP project. Also, ask yourself at the end of the research project, what are the results that you'd like to show? A great way to get started is to go to the AMSN conventions, walk through those poster sessions, connect with the presenters. Believe me, they love getting your questions. Gather your own ideas on what you might be interested in researching. Team up with others with shared interests to do your research. Everyone has strengths that they can bring to the table, and they can make that road a little shorter and a little bit easier. And finally, remember, research empowers us and gives us a voice. It gives us a chance to improve practice and patient care, and it opens the door to a seat at the table for nurses. To our listeners, thanks for joining us. We'll see you next time.
We look forward to connecting with you on the next episode of MedSurg Moments, the AMSN podcast.
In the meantime, we encourage you to subscribe to MedSurg Moments wherever you listen to podcasts.
To reach us, use hashtag MedSurgMoments on your social posts.
Or send us an email at amsnpod@amsn.org. That's amsnpod@amsn.org.
We're all AMSN members, and if you love MedSurg Moments, we invite you to become a member of AMSN. You can learn more at www.amsn.org.
Finally, the content within the MedSurg Moments podcast represents the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses.
Until next time, this is Eric,
Laura,
Maritess.
Neil.
Sam?
And Sydney. And always remember, MedSurg Moments is a moment in our lives and a moment in our MedSurg careers that makes a huge difference.